I was in tears, and the first thing I did do was fall to my knees and thank God for allowing me to become the mayor of this city.
It's over, and it's official. From top cop to top job, Jerry Dyer wins the mayor's seat. We're going to hear from Dyer and the man he beat, Andrew Jans. He'll join me in studio after conceding the race.
He's ushered in the hottest economy in modern history, and now the greatest response to a pandemic that we've seen.
The pandemic that's making everyone hit the pause button on our lives. President Trump's National Press Secretary Kayleigh McEnany will join me exclusively on how the Trump administration is moving forward after Trump's address to the nation. And lots to talk about with our panel, from how the coronavirus could play a big role in the race for the White House to the new dynamic on the dais for the Fresno City Council. It's all on KC24, Sunday Morning Matters.
Now, from KC24, your local election headquarters, with your host, Alexan Balakian. This is Sunday Morning Matters.
Good Sunday morning to you. I'm Alexan Balakian. Thank you for joining us, and join the conversation at Real Alexan. Use the hashtag Sunday Morning Matters. We begin with the pandemic sweeping around the world. The coronavirus has us hitting the pause button on our lives.
That we have directed cities, counties, private, public sector, large and small, all throughout the state of California, to no longer permit large, non-essential events in this state.
Governor Newsom issuing a directive this week for the cancellation of gatherings of 250 people or more. The executive order is having a huge impact on events and concerts, even theme parks throughout the state, as places like Disneyland and Universal Studio shutting down temporarily. And to get a little bit better understanding and perspective of how much the Central Valley is handling this pandemic, Fresno County Supervisor Nathan Massick is here, and Fresno County Health Director David Palmaville is here. Gentlemen, how are you?
Great.
Good to have you here.
Thank you for having us.
I want to start with this. And David, I want to start here. Are we panicking at all? You see everything wiped off the shelves, from toilet paper to water to sanitizers. Are we panicking, or is this being cautious?
Well, we encourage people to have enough supplies for a 10-day to 2-week disaster on any given day. And so if people are prepared for that type of thing, they'll be well prepared for the flu. But we certainly don't need to be going out and stocking up on large numbers of supplies at this point, specifically requiring response to the coronavirus.
Nathan, we've heard from President Trump. We heard the address. We've heard from Governor Newsom. How is the county now following suit once you hear everything that's happened?
Well, what I appreciate about what the president has done, as well as the governor of California, is he's really empowered us here at the local level. The coronavirus is affecting counties differently across the entire United States. Here in Fresno County, we have one case of coronavirus. We're working hard to make sure that that case does not spread, and I have to give a lot of credit to the employees of Fresno County and individuals who work in the health industry that are doing a great job. So here in Fresno County, we're working to keep the coronavirus contained, and we're doing a great job.
You know, Nathan just mentioned it, the one case. David, that one case, how did that person get it? Where are they at in treatment? When can they go back into society?
Yeah, so you heard about the cruise ship that was off the coast of California, and that's where this case came from. And they had been disembarked in San Francisco and came home, and then we were notified that there were cases of coronavirus that were confirmed on the cruise ship. And so we got a list of about 20 people who had traveled on that cruise ship, and we're monitoring all of them. And this is the first positive case that came up from that event.
We've been hearing that there's going to be millions of test kits being distributed everywhere. How many test kits does Fresno County Health Department have? Do they have any? And how soon can testing and how quick can it happen?
Great question. So it's interesting, the test kits we're talking about are actually the test kits that are shipped to the laboratory, not for specimen collection. So for specimen collection, we do these types of swabs of the nose or throat all the time in the medical community, and there's supplies available for gathering the specimen. When they're shipped to the laboratory uses that test kit. And that's the piece that's been in great demand. We have laboratories, 15 laboratories in California that are public health laboratories that can do that testing, and there's 2 major commercial labs that have just come online, LabCorp and Quest Diagnostics. So those are available to us today.
Nathan, I want to come to you because as Board of Supervisors for Fresno County, how are you guys working with superintendents to make sure kids are safe and parents actually have a game plan in place in case they have to take care of their kids or there's no one to watch the kids? This changes the dynamic all too much.
So Fresno County has about 19 different department heads. Dave Palmaville is the Director of Public Health. So really the Board of Supervisors, we're taking our cues from Dave Palmaville. Dave has a team of doctors and other people, staff that work directly for him that are working with the hospitals, working with the schools. And so daily they're keeping everybody on the same page. And daily as well they're measuring the risk that is out there in Fresno County. The #1 goal is to keep everybody safe. We want to make sure we take a measured approach to this virus. We want to keep it contained. And right now, I want to clearly communicate the people of Fresno County are safe. We need to be diligent in washing our hands, what we do. But right now, the citizens of Fresno County are safe, and we plan on keeping them that way.
You know, David, you get a lot of questions, I'm sure. I'm trying to provide as many to you as I can within our time constraints. But really, what's the biggest misunderstanding here? And really, the symptoms involved with this? We've heard a lot that the coronavirus can live on a surface for 3 hours. I don't know if that's fact or fiction. What do you say to some of these questions and the misunderstandings?
Yeah, so part of the problem we have with coronavirus is its symptoms are similar to many other common illnesses that are in the community. And the one we've made a lot of correlation to is the flu. It's a fever, it's a cough, it's shortness of breath. And if you are coughing up droplets, and those droplets can land on a surface, and they can live for hours, but they're easily killed with a basic disinfectant, and over time the virus will die. There have been some studies that show they can last for much longer periods of time, but we really believe that the virus becomes much less virulent over time. So good cleaning of surfaces, making sure that we're washing our hands, covering our cough, those are the most important things we need to be doing.
You know, we've seen the swine flu. That was a pandemic that killed thousands and thousands of people here in the United States. But this seems to be at a different level. And Dr. Fauci, as we've heard so many people, so many times over the last few days, he has said that this is going to get a lot worse. This is going to turn into something even much more bigger than what we're ready for. Are we ready for this? Is it going to happen like he says it's going to happen? I mean, what are your thoughts when you hear something like that?
Well, we know that there is going to be more community transmission cases that we will identify in the coming weeks. And we know that because when we start to look for it in the community, as those test kits become available to laboratories and we see not 1,000 or 1,500, but 10,000 tests in California, we're going to see more documentation of coronavirus. And that's important for us in order to understand how the disease is actually behaving. We do need to be prepared, and it's not just the public health department, the medical community, but we really need the general population to follow the instructions. Stay home if you're sick. Cover those coughs. Hand washing, you're going to hear that over and over again.
Nathan, I want to get to you. Obviously, you and your Board of Supervisors, you have a lot of constituents all over the districts and the county, much like Fresno City Council. They're saying they're going to work remotely. Are you guys going to is it business as usual, or how are you operating?
So at this time, we're not working remotely. I mean, all of us are taking office hours. I was in the office today and will continue to be at the office 7 days a week if need be. But I will say that every day as we monitor this, we'll take the necessary steps to keep the public safe and to keep ourselves safe as well as the employees of Fresno County.
I want to finish with this. Why didn't we see this coming? I feel like we were blindsided by this. How could we have not even had a vaccine or something to prevent what is happening today and almost living in a closet now?
Yeah. Well, a lot of times we don't know about these viruses until they show up in our human systems. And so we learned a lot from MERS and SARS about a vaccine. But vaccines were never developed because the disease really wasn't sustained globally. The platform, the information that we gathered during the MERS and SARS outbreaks is now being used to help expedite the development of a vaccine here. But we will oftentimes see diseases move from animal populations into humans, and we learn as those things become evident to us. We just don't have a lot of good information.
Well, I'm sure we'll be talking to you in the coming days. You guys, thank you very much for being here. A lot of information still coming in, including, yes, the country hitting the pause button on life as the coronavirus hovers over us. The Trump administration taking aggressive action, but could it really decide the race for the White House? President Trump's National Press Secretary, Kayleigh McEnany, joins me exclusively next.